Hi, I'm Ben Court from the Family Osteopath. I thought I'd do this video to try and explain the osteopathic viewpoint on how it is that patients become unwell, and that's patients whether they're day-old babies or children and on into adult life as well, and also why it is that some patients never seem to quite get better, and that they've been and used lots of different therapies, and why it is that their symptoms keep on coming back. And what it is that from a cranial osteopathic perspective we can do to help that situation. So firstly, an explanation as to why we think people become unwell for a whole plethora of different sort of case presentations, from sort of simple low back pain to migraines to colicky children to you name it, knees, hips, backs, heads, tummies, etc. And really we think that a combination of three things. One is actual structural health. So if you get a traumatic event where you're injured in some way, a car accident or a fall off a horse or something along those lines, or a difficult birth maybe in children with forceps, then that would act as a trauma. The second thing would be chemical nutrition, and so that is really about what you're eating, the environments you might be working in, the medications you might be taking, the vaccinations you might have had as a child or be having as a baby. And then the third one, which is a really big one in the clinic that I work in, is emotional sort of welfare and stress. And so many occasions you see that people's backs and necks and babies are unwell because there's an emotional context to their illness. So that's a big one. So we call this the triad of health here. I don't know if you can see it, but here we've got structure, so that's your trauma, nutrition, so what you're eating, and mental and emotional welfare, and creates this sort of triad of health where health is in the middle if all three of these things are looked into and are in the balance that they should be. So if they become out of balance, then that's when patients present into the clinic. So that's the first part. I hope that makes sense. The second part is to try and explain to you again why it is that people keep on coming unwell, or why they come into clinic having seemingly done very little to get themselves into a situation where their back's going into massive spasm, or they keep on getting migraines, or IBS symptoms, those kind of things. So we explain this by the use of the clinic line. If we draw a line, a horizontal line here, and call that the clinic line, most people come in to see us when they've gone above the clinic line and they end up in pain. And below the clinic line, they're obviously happy to all extent and purposes. So when patients have come in, they're in this field normally when we first get to meet. And with a little bit of treatment, it's quite easy to get them below the line. But what we really need to understand is how they got to be near this line in the first place. Because actually, proper health is about being substantially below it, so that any number one of these nutritional, structural or emotional issues, you have a buffer which you use up before you become symptom and pain or painful. From a cranial perspective, osteopathic perspective, we look at it and say, okay, well, you had a stressful pregnancy was here, a difficult birth was here, maybe vaccinations as a child, and you fell off a trampoline age 4, you got divorced age 25, you moved house recently, etc. Everything of these life events have used up this buffer zone between having a healthy balance here and being in pain, symptomatic and painful. So what we're trying to achieve osteopathically is to not just get you out of the pain that you presented for today, but it's to try and answer some of these reasons and the way that the body is held onto these stressful events, whether they're nutritional, emotional or structural, that's got you there and up to that clinic line in the first place. And if we can do that, then that really gets patients happy and healthy for the longer term, not keep on always worried about whether they're going to fall into this massive sort of crisis of pain time and again and again. I hope that makes any sense. So if you need to speak to me about that or want to run any questions past me, as always, give me a call, all the details on the site, and we'll go from there. Bye.